Irish government faces backlash over treatment of nurses. The Irish government is under increasing scrutiny and criticism over its treatment of nurses, who are at the forefront of the nation's healthcare system. Amid ongoing staffing shortages, heavy workloads, and relatively low pay, nurses across the country are expressing growing frustration and demanding substantial reforms. Nurses and midwives have long been vocal about the challenges they face, but the COVID-19 pandemic has intensified these issues, highlighting systemic problems within Ireland's healthcare sector. According to the Irish Nurses and Midwives Organisation, INMO, many nurses are experiencing burnout, leading to a higher turnover rate and exacerbating existing staff shortages. The core issues stem from a combination of factors: inadequate staffing levels, unsustainable workloads, and pay disparities compared to other healthcare professionals and international standards. The INMO has reported that many nurses are working long hours with insufficient breaks, often in understaffed wards, which compromises patient care and their own well-being. One of the most contentious points is pay. Despite the essential role nurses play, their salaries have not kept pace with inflation or the rising cost of living. Many nurses argue that their compensation does not reflect the level of responsibility and the physical and emotional demands of their job. This has led to an increasing number of nurses seeking employment opportunities abroad, where pay and conditions are often more favorable. In response to the crisis, the government has made some efforts to address the concerns of nurses. Health Minister Stephen Donnelly announced initiatives aimed at improving working conditions, including recruitment drives to increase staffing levels and measures to enhance support for existing staff. However, these initiatives have been criticized as being too little, too late. The INMO has been at the forefront of advocating for better conditions, organizing protests and strikes to draw attention to the plight of nurses. In recent demonstrations, nurses have highlighted the lack of meaningful engagement from the government and called for immediate actions, such as pay raises, improved staffing ratios, and better support systems. Political opposition parties have also weighed in, criticizing the government for its handling of the situation. They argue that the government's response has been reactive rather than proactive, and that long-term strategic planning is needed to address the root causes of the crisis. Some have proposed comprehensive reviews of the healthcare system, increased funding for nurse education and training, and more competitive pay scales to retain and attract nursing staff. Public support for nurses remains strong, with many citizens expressing solidarity and calling for the government to take more decisive action. Recent polls indicate that a significant majority of the Irish public believes nurses are underpaid and overworked, and supports measures to improve their working conditions. The government's treatment of nurses has become a significant political issue, with potential implications for upcoming elections. As Ireland continues to navigate its healthcare challenges, the need to address the grievances of nurses and ensure a sustainable, well-supported workforce is becoming increasingly urgent. The current situation highlights the broader challenges within Ireland's healthcare system, emphasizing the need for comprehensive reforms to ensure that those who provide essential care are adequately supported and fairly compensated.